with that, I want to talk about, the history of it, right? When we think about the history, we discussed why we're talking about this topic and the current trends of policy seen by payers in the last recent years. So if we look back historically, when we think about the rules for, policy and revenue integrity professionals have followed for years. Medicare has always set those initial expectations put in place since the inception of the outpatient prospective payment system. And talking about when we look at the original transmittals that were put out, Medicare has always instructed hospitals to use appropriate HCPCS codes. We all know that for those revenue code ranges, to report implantable devices and granted pass-through status, etc. But we also know that a lot of these, some have been package services, right? So no separate payment has been made. However, the cost, right, for these services is included in those transitional outpatient payments and outpatient outlier calculations. So that's really been the importance of why we have always reported these supplies, right, in terms of that. So CMS has always allowed providers to bill those above supply categories, without a HCPCS code, if applicable. There are some restrictions on some of those categories, as we know, that do require, but some, the 270, 271, 272, we do see, and providers do have supplies in those categories without HCPCS codes, for things that are ordered by a physician, medically necessary, etc. And those would return to provider, without any consequence for that. So just kind of setting that stage on some of the history of that, of why, we have followed, and reporting supplies, right? There are supplies we have reported without HCPCS codes historically. Next slide, please. And continuing on that trend for history of charging for supplies, when we talk about CMS, one of the big things for CMS has always been the transitional pass-through payments. This is that list of device eligible for transitional pass-through payments for new device categories that are approved. Those devices expire, as we know, for traditional pass-through payment, and then their costs are included in those APC rates for associated, surgical procedures. So, with that, hospitals have always reported those HCPCS codes, and in some cases in recent years, you've gotten separate payment for them, and now we don't, but we still report those as good practice for those traditional transitional package payments, traditional pass-through payments. So again, hospitals are required to report those devices. They continue to do that and follow those legacy OPPS principles as we know them. Next slide, please. So just a couple of other key excerpts for, when we talk about where we were with this and where we're going. The main, point I want to reiterate is that, Medicare has always wanted us to report charges related to package services, right? Because that impacts the outlier and traditional quarter payments and future rate setting, right? We've always, talked about that. It's really important for hospitals to report all HCPCS codes and supplies that, we believe we should be reporting separately. And CMS has instructed us to do so, right? For those outpatient claims submitted. And so, we've done that. I put the Medicare excerpt there for the Medicare claims processing manual. At the end of the presentation, we do have some of our reference